So let's look at the amount of weight gain recommended based on the pre-pregnancy BMI. So women who are underweight can gain more weight, and then look at the chart for women who are normal weight, 25 to 35, but these numbers go down much when you look at women who are overweight or obese. So women who are obese should only gain about 11 to 20 pounds. And then if you look at the weight gain in the second and third trimester, so much lower, about half of that of normal weight women. And as you can see, this is only for a single pregnancy. That would be changed if they have multiples. Musculoskeletal changes. Upward displacement of the abdomen, that kind of goes without saying. Center of gravity changes, so lordosis, anterior pelvic tilt. The cervical spine becomes flexed more forward. So we do have to worry about balance changes with the center of gravity changes. Estrogen and the hormone called relaxin, which relaxes the hip joints, can cause joint laxity. So women who are already very flexible may suffer from hypermobility or too much flexibility. They may have orthopedic injuries. They may have fallen arches. For example, my former Zumba instructor had problems with her feet in that her arches were falling, and that's what caused her to stop teaching towards the end of her pregnancy. Just her feet were killing her. So the other thing is diastasis recti, and that is a splitting of the linea alba of the rectus abdominis. The developing baby needs to go somewhere. And so you can see where this happens. It usually heals on its own. I've had women show me that they actually still have a fairly good ridge there. They can develop hernias in that area, and surgery could be needed if it really doesn't close on their own. What happens to women with their metabolism and their substrate utilization? So their resting VO2, if you look at that, normal resting VO2 is 1 met, so it is going to increase a little bit more. Greater use of carbohydrate. There's going to be an increased fat synthesis, so that's part of the weight gain. A lot of this happens just as a result of the hormones that are involved with pregnancy. Especially with insulin resistance, there's a hormone called somatomamotropin and other anti-insulin hormones that can lead to gestational diabetes. And ultimately what it does, it protects the glucose to make it available for the fetus versus the mom. The cardiovascular system, there is an increase in blood volume, about 40 to 50%. Of course, you have to circulate all the blood to the developing baby into the uterus. Again, very large blood supply. There is going to be a reduced hemoglobin and hematocrit, so that's going to affect the women's ability to do exercise. So the heart dilates a little bit, stroke volume increases, resting heart rate increases. That's the role of a human chorionic gonadotropin hormone. But your venous return is reduced in the third trimester, so blood flow back to the heart is reduced in the third trimester. Pulmonary changes. Because of the developing baby, there is upward displacement of the diaphragm. There's going to be reduced residual volume left in the lungs, but the vital capacity is not really changed. There is an increased sensitivity to CO2. So there's going to be a slightly increase in blood pH, so they will have a slight alkalosis. There will be some additional bicarbonate excreted in the kidneys. Increased use of the accessory inspiratory muscles as well as a result of the developing baby. So here is a chart from table 8.1 in the guidelines book. So I would know these. Again, what increases as a result of pregnancy and what stays the same or potentially decreases here.